Good day. I'm Dr. K. Girish, physician, neurophysician, and neurosurgeon. This is RNA series 36 Random Questions in Neurology and Neurosurgery with answers by Dr. K. Girish. This, in fact, is to benefit the practitioners of neuroscience and the medical field and for a lifelong learning and also for the public awareness. Now, the question which I'm addressing in this series is, what are the features of Moya-Moya disease? Well, Moya-Moya disease is a rare progressive cerebrovascular disorder characterized by narrowing and blockage of the arteries at the base of the brain, particularly the internal carotid arteries and their major branches. The origin of the name Moya-Moya is a Japanese word for a puff of smoke, describing the appearance of the tangled tiny collateral blood vessels that form to compensate for the blocked arteries which you see in the angiography. The pathophysiology of this, there is a progressive stenosis or occlusion of the terminal portion of the internal carotid arteries and the proximal portion of the anterior cerebral and middle cerebral arteries. This triggers the formation of an abnormal vascular network which are very fragile and are prone to bleeding or thrombosis. It is most commonly seen in East Asia, especially Japan, Korea, and China. There is a bimodal age distribution. It peaks in the childhood, 5 to 10 years, and in the adulthood of 30 to 50 years. The female to male ratio is about 2:1. Now, what is the etiology of this? Sometimes you find no underlying cause can be identified. It's idiopathic Moya-Moya disease. Then there is a group of syndrome, Moya-Moya syndrome. It can form part of some other diseases. Similar vascular changes associated with other conditions like Down syndrome, sickle cell disease, neurofibromatosis type, autoimmune disease, cranial irradiation post. And what are the clinical features of these? In children, there can be ischemic symptoms, like the transient ischemic attack, sudden onset of weakness and coming out of it, sometimes a full-fledged stroke, seizures, developmental delays or cognitive impairment, and in adults, hemorrhagic events are more common. Intracranial hemorrhages, headaches, cognitive decline, and diagnosing is with MRI and MRA. And identifies the MRA identifies the narrowed vessels and the collateral formation. CT may show the infarcts or hemorrhage. This shows the stenosis at ICA bifurcation. A puff of smoke, appearance of collaterals are seen in the radiology, especially in MRA. And what is the genetic association of this? It's linked to RNF213 gene mutation in the East Asian population. Familial cases such as suggest an autosomal dominant inheritance and an incomplete penetrance. Now, the management is antiplatelet agents can be given like aspirin to prevent further ischemic strokes. Management of the risk factors like hypertension, hyperlipidemias, surgery forms the mainstay of treatment. Revascularization procedures to restore the cerebral blood flow, like the direct bypass with STA, MZA, anastomosis, indirect bypass like the encephaloduro-arteriosynostosis, EDAS. Well, these are some of the surgical procedures. The prognosis, what exactly it is. Without treatment, the disease is progressive and may lead to multiple strokes. Surgical revascularization can significantly improve the outcome. Early diagnosis and intervention are the key, very important. You can do regular neuroimaging, cognitive and development assessments in children can be done, and of course, those who had stroke, post-stroke rehabilitation will have it done. That's a D answer to the RNA series 36 question. What are the features of Moya-Moya disease? Thank you. Thank you very much.